Hello everybody, I am Dr. Pawan Zutshi. I am a senior consultant interventional cardiology at Metro Heart Hospital, Sector 12, Noida. Today I'll be discussing a very important topic that is in vogue these days, hypertension in young patients. In our OPDs, on a day-to-day basis, we see very young patients ranging from 25 to 35, 40 years coming with high blood pressures, especially in the post-COVID era. As we see, they come with blood pressures of 180, 200 with even high heart rates. So why is it happening like this? Now of late we see that because of the changing lifestyle, especially in the urban areas, and weight gain in a majority of the patients, obesity, that is one of the contributing factors. Obesity leading to increased secretions of catecholamines in our body, the hormones which increase blood pressure. The other factor is diabetes, which is borderline diabetes or manifest diabetes, which is very common in obese young patients these days. That may also cause some level of renal involvement, kidney involvement and scarring, which further leads to potentiation of blood pressure issues. And third is snoring, sleep apnea, the respiratory issues, tongue fall during sleep, which again causes, by increase in the hormonal secretions, causes blood pressure. So blood pressure is a manifest disease these days in diabetics, in young patients, in sleep apnea patients with a bad lifestyle. Now, first of all, we have to address the lifestyle issues in these patients, mainly with the lack of exercise that these people are having. So, we have to increase some form of exercise, at least 25 to 30 minutes brisk walk, at least 5 to 7 days a week. Secondly, minimize the intake of salt. Normally, the salt intake, it should be reduced to less than 1/3 of a normal person. That would roughly be around 2 to 2.5 grams in 24 hours. A normal male of a younger age group would consume normally 5 to 6 grams and sometimes even more once you are eating food from food stalls outside or street food and all. So we have to minimize that also. Third is good sugar control. Junk food has to be taken out of the system, and we should be more or less concentrating our diet mainly on increased intake of vegetables, fruits, dry fruits, fish food, and lean meat, that is chicken, and avoidance of saturated fats via red meat. And then some amount of cheese, yogurt, curd is also okay. Daily exercise along with meditation will also benefit in lowering the blood pressure in these patients. It has been so much seen that only the lifestyle, if what I have just mentioned, if we take care of that lifestyle, it is equivalent to a single drug therapy in the treatment of blood pressure. So we can prevent drug therapy in young patients who have blood pressures of up to 140, 145, 150 systolic blood pressure by taking care of these factors. Secondly, in the post-COVID era, we have to minimize smoking, alcohol, and nightlife and stress. Try to sleep early, give 5 to 6 hours of sleep to your body and rest, and avoid smoking, avoid alcohol, and take care of the binging and nightlife that we have. And regarding BPO employees, those people who work in call centers in night hours, that period has to be minimized as much as possible, because that is one contributing factor in young patients for the development of hypertension. I think I've discussed whatever is relevant in today's world, and all the best to all the patients. Thank you.